Today we are talking about what happens when a patient with atrial fibrillation suffers a stroke, even though they are already on a direct oral anticoagulant or DOAC, and it's a tough situation which many clinicians may face. So the big question is, should we keep them on the same DOAC, switch to another one, or move them to warfarin? A new meta-analysis published in Neurology in August 2025 helped shed some light on this dilemma. So researchers pooled data from over 14,000 patients across 8 studies, all of whom had atrial fibrillation and suffered a so-called breakthrough ischemic stroke while taking a DOAC. And here's what they found. Switching to warfarin turned out to be a bad idea. Now, those who made the switch had double the risk of another stroke, triple the risk of intracranial hemorrhage, and even higher mortality compared to those who stayed on or switched between DOACs. Meanwhile, continuing the same DOAC or switching to another DOAC, even one with a different mechanism like from a factor 10A inhibitor to a direct thrombin inhibitor, resulted in similar outcomes with no significant increase in stroke recurrence. So what's the takeaway? If your patient has a stroke while on DOAC, resist the temptation to fall back on warfarin. Instead, evaluate compliance, kidney function, and possible drug interactions. If these check out, either maintain the same DOAC or consider changing to another one. This meta-analysis supports what many of us are already doing in practice, sticking with DOACs and avoiding warfarin whenever possible. In short, when stroke breaks through, don't go backwards, stay the course, or switch within DOAC class, but steer clear of warfarin. Thank you for your attention, and as usual, the link to the reference is in the video description.